Hello and welcome to this recording of our Health and Science Technical Qualifications Best Practice Network, where we explored stretching and challenging students. So the aim of our Best Practice Network is to equip educators with research-based strategies and practical approaches to elevate student learning in T-levels. So throughout this recording and in our live session, we're exploring and discussing strategies for stretching and challenging students. We're looking at collaboration from your fellow educators and sharing their insights and experience, and this to help create actionable steps to inspire students towards a higher achievement. So let's begin with our first theoretical foundation. Understanding student challenges and growth mindset theory. T-level students often face advanced and unfamiliar content, which can be challenging at times, intimidating. Growth mindset theory encourages students to see these challenges as opportunities to grow rather than as barriers to their success. According to Dweck's research, students with a growth mindset, those who believe that abilities can develop through dedication and hard work, demonstrate greater resilience. This resilience is crucial in handling complex subjects and is especially important in high-stakes assessments like the core exams and the employer set projects, or ESPs. Incorporating growth mindset principles into T-level teaching can help students view difficult tasks as achievable with the right effort and strategies. For example, when students approach technical subjects like science, health and healthcare science, we encourage them to embrace mistakes as part of their learning process. This approach can foster persistence and engagement, helping them keep moving forward even when the content feels challenging. Encouraging this mindset doesn't just build resilience, it also prepares students for the demands of their future careers, where they'll need to continuously adapt and grow. So our first question for you to consider is, what are the primary challenges you face in pushing students beyond their comfort zone in T-levels? Take a moment to consider this. Here are what your peers shared. So from the word cloud provided, the primary challenges teachers face in pushing students beyond their comfort zones in T-levels can be summarised as follows. Student disengagement. Some students are willing to try or lack motivation. Difficulty understanding relevance. Students question the purpose of certain knowledge or skills, e.g., why do I need to know about such and such to be a paramedic? Fear of failure. Many students are afraid to make mistakes or fail. Mixed ability levels. Teachers said that they face challenges catering to a wider range of abilities within a single class. And finally, challenges in conveying importance. Teachers have said that it can be difficult to help students understand the reasons behind certain activities or tasks. These challenges highlight a need for strategies to increase engagement, build confidence, and make the curriculum feel relevant to student goals. We further explored examples of when students have shown resilience or shifted their perspectives, as summarised from the word cloud. We have, in regards to resilience examples, managing difficult situations. So a student who was very anxious about caring for a dying patient managed the situation well and was able to share their experience afterwards. Another example was in regards to perseverance after challenges. As students returned to year 2 despite having poor grades, demonstrating commitment and resilience. In regards to shifting perspectives, taking initiative. A student took their own initiative to find revision sessions, showing self-motivation. Re-evaluating career choice. A student realised nursing was still the right career path for them after experiencing a bad placement, reflecting a positive shift in perspective. These examples highlight personal growth and determination in overcoming challenges and adapting their mindset. So how can we foster a growth mindset in T-level students? Reframe mistakes as learning opportunities. For example, after an assessment or practical task, hold a mistake analysis session where students review their errors and identify what they learned from each one. For example, in education in early years, during a mock activity planning session, if a student overlooks a child's individual needs, they could analyse how this impacts the activity and develop strategies to incorporate differentiation next time. They could set goals focused on effort and improvement. For example, at the beginning of the term, having students set specific measurable goals for skills they want to develop, such as in health T level, I will create at least 3 healthcare plans that align with the legislation from the health and social care sector. Or, in science, I will practice giving effective feedback to my peers in a positive and constructive way. Regularly revisit these goals to discuss progress and reflect on achievement. Use yet language to encourage progress. So encourage students to use yet in their self-assessment. For example, for healthcare science, I haven't mastered writing detailed quality improvement reports yet. This simple language shift fosters a mindset that success is achievable through consistent effort. Celebrate effort and perseverance, not just achievement. For example, set up a growth wall in the classroom or a virtual platform where students can post achievements related to effort. So, for example, for education in early years, I rehearsed delivering storytelling sessions and felt much more comfortable engaging the children today. Highlighting perseverance creates a positive classroom culture that values growth. Encourage reflection through learning journals. So have students maintain a learning journal where they track progress, challenges, and strategies for overcoming difficulties. So for example, in science, students can record their experiences designing experiments for different audiences and note how they respond, helping to refine their future approaches. Discuss growth mindset in class. So use a short video or a story on growth mindset to kick off a discussion. Encourage students to share personal experiences. For example, share examples of times when working through challenges led to better outcomes. Relate these discussions back to how their T-level skills develop through effort and practice. Model a growth mindset as a teacher. So share your learning journey with students. For example, in education early years, I've been experimenting with new methods for giving feedback to students, and some are working better than others. Here's what I've learned so far. This demonstrates to students that learning is a lifelong process. Provide constructive feedback focused on improvement. So when grading or giving feedback on assignments, include specific guidance on areas for improvement rather than just a grade. Our second theory is exploring innovative strategies to stretch learning and zone of proximal development. So Vygotsky's zone of proximal development, or ZPD, is all exploring optimal learning that happens just beyond a student's current abilities, where they can progress with the right support. This aligns well with T-level curricula, where students are often asked to apply foundational knowledge in practical, real-world situations that require critical thinking and problem solving. To support students in reaching their ZPD, scaffolding can play a crucial role. Scaffolding provides students with incremental support, helping them tackle complex tasks like healthcare simulations, science lab projects, or observations within education. With this support, students gradually master new skills and gain confidence. So the next question I'd like you to consider is, are strategies that help stretch your students' learning within the T-level framework. So take a moment to consider strategies that you've already used. So the strategies shared by your fellow teachers to stretch students' learning within the T-level framework included shared research articles, so providing research articles to link theoretical knowledge with real-world applications. Case study use, utilising case studies to engage students in applying their learnings to realistic scenarios. Interactive and hands-on learning, moving beyond PowerPoint presentations to include interactive and practical activities, such as making things engaging in collaborative tasks. Problem-based learning, encouraging students to solve problems as a way to deepen understanding and develop critical thinking skills. Subject-specific strategies, for example in immunology, using diagrams to simplify complex ideas and then expanding on them with detailed explanations. Students are also encouraged to explain their reasoning behind specific actions or conclusions. Starting earlier with past exam questions. Introducing past exam questions earlier to familiarise students with assessment styles and expectation. So these strategies are designed to align with ZPD principles, supporting students to complete tasks with guidance before achieving independent competence. These strategies highlight a focus on making learning more interactive, contextual, and aligned with assessment goals while supporting skill development within students' capacity to grow. So here are some of our key scaffolding strategies for T-levels. So first one is Socratic questioning. This technique involves asking guiding questions that prompt students to think deeply and articulate their reasoning. Socratic questioning challenges students to explain, analyse and justify their answers, leading them toward greater understanding. So for example, in a healthcare simulation, ask questions like, what would happen if you skipped this step in patient care? Or how does this procedure prevent infection? These questions encourage students to engage critically with their learning. Next, real-world applications. So creating tasks that mirror real-life scenarios helps students understand how their knowledge applies outside the classroom. This approach is particularly valuable in T-levels, where skills are often translate directly to professional contexts. So for example, in science lab, students might analyse water samples as if they were environmental scientists. By connecting theory to real-world scenarios, students see the value of their learning and are encouraged to solve practical problems. Structured peer mentoring. So pairing students with peers for collaborative work or mentoring provides mutual support and allows them to learn from each other's strengths. Peer mentoring helps students clarify concepts and gain confidence through guided interaction. So for example, in T-level health, an experienced student could mentor a peer in performing patient assessments, reinforcing both students' understanding of the material through teaching and practice. Think aloud problem solving. So this strategy involves the teacher or peer verbalizing their thought process while solving a problem. By modeling how to break down a task, students learn how to approach complex challenges themselves. So for example, during a healthcare simulation, the teacher might walk through steps out loud, explaining decisions made at each stage. This method helps students see the reasoning behind each action and can improve their own problem-solving skills. Graphic organisers and visual aids. So visual tools like graphic organisers, flowcharts and concept maps help students organise and process information. These tools simplify complex concepts and show relationships between ideas, making learning more accessible. So for example, when studying biological systems, a concept map can help students see the connection between organs, functions and processes. This visual aid provides a reference as students learn more details. Next, we have gradual release of responsibility, also known as I do, we do, you do model. This approach gradually shifts responsibility from teacher-led instruction to student independence. It begins with modelling, moves to guided practice, and finally allows students to complete tasks independently. So for a science experiment, the teacher first demonstrates the procedure, I do, then works through it with students, we do, and finally has the students perform the experiment independently, you do. This gradual approach builds confidence and competency. Next, we have checklists and step-by-step guides. So providing students with checklists or step-by-step guides help them navigate complex tasks by breaking them down into manageable parts. This scaffolding tool supports students in understanding each stage of the process and builds autonomy. So in healthcare science, students could use a checklist to ensure they complete each step in blood analysis correctly. Over time, they become familiar with the process and may no longer need the checklist. Reflective practice exercise. So encouraging students to reflect on their learning experience helps them internalise and consolidate new skills. Reflection enables them to analyse what they did well, what could be improved, and how they can apply these lessons in the future. So after a role play scenario in healthcare settings, students can journal or discuss what went well, what was challenging, and what they'd do differently next time. This reflection process deepens learnings and prepares them for real world application. Our next theoretical foundation is around collaborative exploration, exploring constructivist theory through the use of a case study. So constructivist theory, developed by thinkers like Piaget and Dewey, emphasizes that learning is an active process where students construct their own understanding rather than passively receiving information. Students engage directly with the content, building knowledge through experiences and interaction. In T-level, this approach is particularly valuable by embedding real-world context, such as simulations or practical assessments. We give students opportunities to apply their knowledge in hands-on settings. For example, during placements, students encounter realistic scenarios that require them to think critically, solve problems, and make decisions, actively constructing their understanding of professional practice. This approach aligns well with the goals of T-levels, where learning is not just theoretical but applied. By engaging directly with practical tasks, students build skills that are essential for their future careers. So I would now like you to consider and jot down some ideas around constructivist strategies to help students build understanding from prior knowledge. Take a moment to write a few ideas down. In our best practice network, we gave a case study example of Liam, who is a student struggling with health data analysis. And you can see that a case study there on the right. You can see what his assignment was and key areas that Liam felt overwhelmed and disengaged and why. So now thinking about some of the ideas that you jotted down previously, consider how you could help Liam build understanding from prior knowledge. So these are some of the examples our teachers gave. Creating a resource. Develop compact resources of useful facts such as normal ranges, prompts and common disorders that is easily accessible, e.g. a pocket-sized guide. Fostering a safe classroom environment. Cultivate a culture where students feel safe to make mistakes and learn from them, reducing fear and building confidence. Using mnemonics and stories. Leverage mnemonic devices and storytelling techniques to make complex information easier to recall and understand. Breaking down information. Simplify tasks by breaking them into smaller, more manageable chunks to help them gradually build confidence and comprehensions. So these strategies aim to reduce Liam's feelings of overwhelm and disengagement by providing structured support tools and fostering an environment conducive to learning. These strategies you can utilise within your own delivery. Here are 6 strategies T-level teachers can use to apply constructivist theory in their classroom, helping students actively construct their understanding through hands-on, practical learning experiences. The first one we have is problem-based learning, or PBL. This involves presenting students with real-world problems that they must solve, which encourages critical thinking and problem solving. So for example, in a health T-level, present a case study where students must diagnose a patient and propose a treatment plan, working through steps just as they would in a clinical setting. Next, we have collaborative learning projects. So group work encourages students to share perspectives, question each other's ideas, and construct knowledge collectively. So for example, in a science T-level, assign students to small groups to work on a lab project, such as analysing environmental samples, where they must collaborate to collect, analyse and interpret data. Experiential learning through simulations. So simulations replicate real-world scenarios, allow students to learn by doing, make mistakes and reflect on their actions in a safe environment. Set up a healthcare simulations where students can practice patient care, taking vital signs or responding to medical emergencies, mirroring the tasks they'll encounter in professional practice. Scaffolded inquiry-based learning. Inquiry-based learning involves asking questions and investigating topics, with scaffolding to support students as they navigate complex ideas. So for example, in healthcare science, start with questions like what factors affect blood pressure? Guide students through research, experiments and analysis, gradually releasing support as they gain confidence. Scaffolded inquiry-based learning is a really good precursor to problem-based learning. Next, we have reflection and self-assessment. Encourage students to reflect on their learnings, assess their progress, and identify areas for improvement, focusing on growth mindset and deeper understanding. After completing a practical task or placement, ask students to journal about what they've learned, the challenges they face, and what they would do differently next time. This self-reflection helps solidify learning. And finally, real-world case studies and role plays. Case studies and role plays allow students to immerse themselves in realistic scenarios, help them apply theoretical knowledge to real-world situations. So for example, students could apply theoretical knowledge to create a tailored healthcare plan, considering the patient's conditions, required physiological measurements, and protocols for ongoing care. This exercise helps students think critically about individual patient needs and adapt their learning to real-world healthcare situations. Our next theory we're going to explore is building resilience and independence in students with self-determination theory, or SDT. So SDT, developed by psychologists Edward Deci and Richard Ryan. SDT emphasizes the three basic needs: autonomy, competence, and relatedness are essential for intrinsic motivation. When these needs are met, students are more engaged, motivated, and willing to take on challenges. For T-level students, developing autonomy and competence is crucial as they work towards becoming independent learners and preparing for hands-on real-world tasks. Meeting these needs help them feel empowered and capable. In T-level courses, we can apply SDT principles to enhance student motivation, especially for tasks like the employer set project, where students are required to work independently. By providing opportunities for choice and self-direction, we foster a sense of autonomy. When students feel competent in their skills through targeted feedback and support, they're more likely to engage deeply and succeed in these ESPs. This approach not only prepares students for their assessment, but also builds quality for their future careers. I would like you now to consider which skill or skills do your students struggle with the most? So these are the four key ones that we've explored in relation to stretching and challenging our students. So critical thinking. Students find it challenging to think critically, evaluate evidence and make reasoned judgments. Self-directed learning. There is difficulty in taking initiative, managing their own learning and working independently without constant guidance. Students face challenges in bouncing back from setbacks, adapting to challenges, and maintaining motivation in face of adversity. And finally, persistence. Struggling to stay committed and push through challenges over a prolonged period of time is a significant issue. So these struggles suggest a need for targeted support and strategies to build these skills, such as scaffolding tasks, providing constructive feedback, and fostering a growth mindset. So here we have some strategies for applying SDT in T-level classrooms, taking the key areas in their own, so autonomy, competence, relatedness, and a combination approach between autonomy and competence and relatedness and competence. So for the first one, autonomy, provide choices and self-directed projects. Give students options and assignments or projects, allowing them to choose topics, methods, or resources that interest them. So for example, in health, allow students to choose a case study related to specific health conditions to analyse and present. This choice fosters a sense of ownership and personal investment in the task. Next, for competence, we have scaffolding tasks with clear progression, So break down complex skills into smaller steps with clear expectations and support. As students build these skills, they develop confidence in their competence. So for example, in healthcare science, create a progression for skills, like taking blood measurements, from learning the theory to hands-on practice with feedback, so students gain competence gradually. The other example we have for competence is offering constructive targeted feedback. So provide specific, actionable feedback that highlights student strengths and offers guidance on areas for improvements. Celebrate growth and progress to reinforce a sense of competence. So for example, in science, after a lab experiment, give feedback on each part of the process. For example, data collection, analysis, and safety protocols, helping students see where they are excelling and where to focus on improvement. Next, for relatedness, create group learning opportunities. Collaborative tasks help students feel connected to their peers and reinforce a sense of community and shared goals. So in health, organise group discussions or problem-solving sessions where students work together to analyse healthcare scenarios. Help them feel supported by and connected to their classmates. For the combination of approach of autonomy and a competence, encourage reflective practice and self-assessment. Have students reflect on their learning, set personal goals and assess their own progress. This helps them take responsibility for their growth. So for example, in healthcare science, after completing a practical task, ask students to self-assess their performance and reflect on areas they'd like to improve. This promotes self-directed learning and a sense of achievement as they see their progress. For a combination between relatedness and competence, show how classroom content relates to real-life applications in the health and science fields, helping students see the value and purpose of their learning. Like for in regards to science or health, link topics like environmental health or human physiology to current healthcare issues or scientific issues, demonstrating how their skills are valuable for future careers and societal impact. Our final theory we're going to touch on is developing actual strategies for classroom implementation with Bloom's taxonomy. So Bloom's taxonomy encourages higher order thinking, progressing from basic understanding to advanced skills like analysis, evaluation, and creation. In T-levels, these higher order thinking skills, or HOTS, are essential, especially as students engage in assessments that require them to apply, critique, and synthesize information. To develop these skills, we can design tasks that move through stages of Bloom's taxonomy. For example, start by having students analyze a case task, then ask them to evaluate different scenarios, and finally challenge them to create solutions to the problems. This approach gradually builds a critical thinking and problem-solving skills, preparing students for real-world situations and high-stake assessments. Incorporating Bloom's taxonomy into T-level coursework not only supports assessment success, but also equips students with analytical and creative skills. So let's finish up with some final thoughts and areas to continue to get support and resources in regards to stretch and challenge. So after this session, spend some time reflecting on strategies to stretch and challenge your students. Reflect on some strategies you wrote down and strategies we've shared, how these align with your current teaching practices, which you think will be most impactful in your T-level classroom, and how you can implement these strategies to enhance student engagement and higher order thinking. Here we have some reading materials that you can utilise within your continual professional development. We have the growth mindset in education, and through there you can explore mindset in teams program through PsychReg, and changing mindset program through the Education Endowment Foundation. In relation to self-determination theory, we have key research from the University of Birmingham exploring these in relation to assessment and feedback. So before we wrap up, I would love to hear your feedback. Please take a few minutes to complete this feedback form. for our Health and Science TQ's BPN. Your insights are incredibly valuable and help us improve our offerings. You can access the form via the QR code on the right or by visiting the link provided. Thank you for helping us make these sessions as impactful as possible. Thank you very much for listening to this recording on our Best Practice Network for Health and Science T-Levels, exploring, stretching and challenging our T-Level students.